Good morning, everyone. How are you doing today? I hope you're doing wonderful. And for today's video, we will be talking about AKI or ARF. So, acute kidney injury or acute renal failure. So, again, this is your acute dialysis nurse. So, for today's topic, again, AKI and ARF. So, let's define what's acute renal failure. So, acute renal failure is sudden, severe impairment of kidney function. This is reversible if it's diagnosed and treated early. So, reversible. So, contrary to chronic renal failure, this is reversible. Chronic renal failure is irreversible. So, reversible if it's diagnosed early or treated early. So, it can happen for hours to days. So, in contrast to CKD or chronic kidney disease, the CKD can happen for years and years and years, so slowly damaging the kidneys. So, what are the indication for starting dialysis on AKI or ARF? We'll just use acute renal failure, ARF. So, what are the indication to start the dialysis on AKI or ARF? Dialysis indication. So, first, uremia. Hyperkalemia, metabolic acidosis, fluid overload, drug overdose, severe oliguria, or anuria, encephalopathy, and uremic pericarditis. So uremic pericarditis, cause of uremia is it attracts water. So if we have too much toxins inside the pericardial sac, the uremia, the toxins attracts water, so more water goes into the pericardial sac, causing pericarditis, and it can also cause cardiac tamponade. So uremia, usually this one is if it's too high in BUN. So BUN usually more than 150. And hyperkalemia, metabolic acidosis, yep. And for the drug overdose, so the drugs, it can be aspirin, it can be ethylene glycol, so those kind of stuff. So these are indications when to start dialysis on AKI. So basically for AKI, so we are trying to just to help out the kidneys, but we're not doing it very aggressive that it can cause hypotension, because in AKI, BP is very important. So we have to maintain a normal BP, because if we have a low BP, then uh, it can damage more the kidneys. It can cause more damage to the kidneys, and the likelihood of the kidneys recovering is pretty low. So AKI, make sure that blood pressure is always normal. MAP is always more than 65. Otherwise, you're gonna cause low perfusion on the kidneys, which can contribute to more kidney damage. So indication, we're done with indication. So next, we'll go with signs and symptoms. So signs and symptoms. So first, urine output less than 400 ml per day. Or less than 20 ml per hour for adult. High BUN and creatinine, high potassium, and acidosis. So these are most likely the symptoms when you're having acute renal failure. Now let's go to causes. So what causes acute renal failure? So we have three category that can cause kidney acute renal failure. So we have pre-renal, intra-renal, and post-renal. So pre-renal, this is before the kidneys. So that's the cause of damage is before the kidneys. So shock. So if we have shock, we have low blood pressure. So there's gonna be low kidney perfusion. So low circulatory, low blood volume. So low blood volume again causes low BP. Volume shift. So volume shift from intravascular, it shifts to interstitial. Again, if that happens, it will decrease blood volume. Low cardiac output, same thing because we have low blood volume. Low peripheral vascular resistance. So low peripheral vascular resistance, this is connected to shock. So if you have low peripheral vascular resistance, you're gonna be having low blood pressure, and then that's gonna decrease perfusion on the kidneys. Renal artery obstruction. So renal artery obstruction. Remember, renal artery supplies the oxygenated blood to the kidneys. So if that's obstructed, then it's gonna cause uh, damage to the renal to the kidney tissues. Next is we have intrarenal. So this one is intra means it's inside the kidneys. So inside the kidneys we have first is ATN. This is acute tubular necrosis. So we will discuss this later on, pathophysiology of acute tubular necrosis in a little bit. And then renal trauma. So trauma, it can be force, blunt force, it can be penetration, those kind of things. Severe muscle exertion. So severe muscle exertion, this is example is the rhabdomyolysis, wherein the muscles release a large amount of myoglobin that can block uh, the glomerulus, causing low filtration in the nephrons. Next is genetic condition. Infectious disease, such as the lupus and the metabolic disorders. Glomerulonephritis, renal artery lesions, and vascular disease. such as diabetes, hypertension, multiple myeloma. So this diabetes and hypertension, they cause these are the top two diseases that can damage the kidneys. That it can damage the kidneys for a long period of time, and then you don't know or you don't feel the symptoms unless it's already severe. For multiple myeloma, so the bones they release too much calcium. So for post-renal, we have benign prostatic hypertrophy, enlarged prostate, obstruction, such as kidney stones, spinal injury, and pelvic trauma. So that's it. So causes of acute renal failure: pre-renal, intrarenal, and post-renal. So these are the causes. Okay, so let's check. Let's discuss ATN, acute tubular necrosis. So acute tubular necrosis can be due to surgery, trauma, sepsis, cardiovascular collapse. This is sepsis, shock, and nephrotoxic injury. So these are the causes of acute tubular necrosis. So nephrotoxins. So nephrotoxins, what are nephrotoxins? So first we have hemoglobin from hemolysis. So this damage the kidneys if you have too much hemoglobin from hemolysis, too much myoglobin, such as during the rhabdo. This is rhabdomyolysis. Aminoglycosides. These are your gentamicin, amikacin. These are very nephrotoxic drugs. Anesthetics, contrast. So contrast, they cause direct toxic effect to tubular epithelial cells. So they causes cell death for this contrast dye. Chemo and street drugs. So street drugs such as your methamphetamine, so they cause constriction of your vessels that supply the kidneys, causing decreased supply of blood to the kidneys. So note, the primary cause of AKI is infection related. So you usually see this during sepsis, when you have patients who have sepsis and they were not treated early, so it can lead to septic shock. So septic shock can lead to profound hypotension. So profound hypotension decreases perfusion to the kidneys. So decreased kidney perfusion leads to kidney damage. So how about the NSAIDs? Because these are also nephrotoxins. NSAIDs. Oh, let's put it up because it's already no space. So NSAIDs, these are non-steroidal anti-inflammatory disease These are your tramadol, uh, Advil, Motrin, ibuprofen. Those medications. These are NSAIDs. So what does NSAIDs do? So NSAIDs blocks prostaglandin. So NSAIDs, they block prostaglandin, which can lead to decreased kidney perfusion. So how does that happen? So let's define prostaglandin. So prostaglandin, so they blocks prostaglandin production. So prostaglandin, they regulate kidney function. Prostaglandin regulate kidney function. So again, prostaglandin, they regulate kidney function. This has a direct vasodilatory effect on the kidney vessels that increases blood flow to the kidneys. So vasodilate and then increase kidney perfusion. So if you use NSAIDs, you block prostaglandin production. So you decrease the vasodilatory effect to the kidney perfusion. So instead of increasing kidney perfusion, it decreases kidney perfusion. So decreased kidney perfusion leads to acute renal failure. So that's the explanation why NSAIDs can also cause acute kidney injury or acute renal failure. So what other things that causes acute renal failure? So we have here AIN. So acute interstitial nephritis. So what's acute interstitial nephritis? So inflammatory cells infiltrate spaces between kidney and tubules. Inflammatory cells infiltrate spaces between the kidney and tubules, which can lead to decreased renal function. So these are caused by some drugs. AIN, acute interstitial nephritis, are caused by drugs, NSAIDs, and then antibiotics. So, what are the symptoms of AIN or acute interstitial nephritis? So, we have fatigue, exhaustion, and then microhematuria. So, we have also nausea and vomiting, muscle pain, mental status changes. So this one is already if you have already uremic encephalopathy, mental changes. If you have already elevated the BU and creatinine. So what are the treatment? So you discontinue. The main thing is discontinue offending agent. So if you're using antibiotics such as uh, gentamicin, amikacin, you have to stop those drugs, and usually it will help your kidneys recover. So hydration, make sure we have enough blood volume, enough good blood pressure to keep perfusing the kidneys. Electrolyte management, if your potassium is high, then they can give some medications to keep it low, and avoid fluid overload. So you have to maintain a strict INO, or intake and output monitoring, and of course avoid nephrotoxic agent. Avoid nephrotoxic agent. So that's it. Acute interstitial nephritis. So next, moving on. So next, how do they stage acute renal failure? So they use the acronym RIFLE. So in chronic kidney disease, they use staging through estimated GFR values. So RIFLE. So this is your creatinine, and this is your urine output. So R is risk. So you are at risk if your creatinine has increased to 1.5, your baseline. So usually for creatinine, normal for male is 0.7 to 1.3. Normal for female is 0.6 to 1.1. So let's say your normal is 1.3. If your creatinine has increased to 1.3 times 1.5, so you're at risk for acute renal failure. And if your urine output is less than 0.5 ml per kilogram per hour times 6 hours. Again, risk if your creatinine has increased to 1.5 and you have decreased urine output of 0.5 ml per kilogram per hour for 6 hours. I. I is for injury. So injury, if your creatinine has increased 2 times fold. So normal baseline multiplied by 2. If it increased by 2 times, then and then your kidneys has already injury, or urine output of less than 0.5 ml per kg per hour times 12 hours. That's injury. F is failure. So for failure is your creatinine has increased times 3 of your baseline, or creatinine is more than or equal to 4 milligrams per deciliter, and you have urine output of less than 0.3 ml per kg per hour uh, times 12 hours. So it's less than 0.3. Or anuria, no urine, times 12 hours. So that's F for failure. Next is loss, L for loss. sulfur loss, there is persistent acute renal failure, and there's a complete loss of renal function for 4 weeks. Complete loss of renal function for more than 4 weeks. That's loss. Next is E for ESRD. That's already end stage renal disease. This one, this one is that's the time you will be needing renal replacement therapy. So end stage renal disease. That's it. So rifle. That's how they categorize acute renal failure. So rifle, R for risk, I for injury, F for failure, L for loss, and E for ESRD. There you go. So I think that's it. We're all done with today's lecture. It's acute kidney injury or acute renal failure. So thank you again for watching, and I'll see you in our next topic. Take care.